Right now, as you watch this video, millions of seniors across America are taking a medication their doctor prescribed years ago. It sits on the bathroom shelf. They take it every single morning without a second thought, and it may be slowly erasing their memory. I am Dr. James. I have spent years reviewing peer-reviewed medical research so that you do not have to. And today, I am sharing the 5 medications most closely linked to rapid memory loss in seniors. Medications that most doctors never warn you about. Stay until number 1, because it is the most common medication on this entire list and the most dangerous. Let us begin. Everything I share today comes directly from studies published in journals like JAMA, The Lancet, and the British Medical Journal. I will show you the research, I will show you the numbers, and I will tell you exactly what to do if any of these medications are in your medicine cabinet right now. Before we start, I want to hear from you. Tell me in the comments below, how old are you, and how many medications do you take every single day? I read every comment, and your answers shape exactly what I cover next. Number 5 is one that sits on the open shelf at every pharmacy in America. You do not even need a prescription. It is diphenhydramine, sold as Benadryl. Millions of seniors reach for it every night to fall asleep, calm an allergy, or get through a cold. It costs almost nothing, and almost everyone assumes that because it requires no prescription, it must be perfectly safe. But here is what it is doing inside your brain. Benadryl belongs to a class of drugs called anticholinergics. These drugs block a brain chemical called acetylcholine, the very chemical your brain uses to form new memories and stay alert through the day. As we age, our brains produce less of this chemical and depend on every drop that remains. Block it with a nightly pill, and the cost to your memory is very real. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared with those who avoided them. More than half again the normal risk, from something most people treat like candy. Here is what to do. Check any pill you take for sleep or allergies. Anything marked PM, nighttime, or allergy relief may contain Benadryl under a different name. Safer alternatives like loratadine, sold as Claritin, do not cross the blood-brain barrier the same way. Speak to your doctor before making any change, but stop assuming that over-the-counter means safe for your memory. Number 4 is one of the most prescribed drugs in the world. Omeprazole, sold as Prilosec, esomeprazole, sold as Nexium. These drugs shut down acid production in your stomach, and millions of seniors take them every single day for heartburn and reflux. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come back. So the pill feels like the only thing holding the line. Here is the part that almost nobody hears at the pharmacy counter. Your stomach needs acid to absorb vitamin B12, a nutrient that protects the wiring of your brain and your nerves. Long-term use of these medications quietly starves your neurons of B12. And research has also shown that PPIs raise levels of amyloid beta in the brain, the exact sticky protein that builds up in Alzheimer's disease. A 2016 study in JAMA Neurology followed over 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than those who did not take them. If you take a PPI every single day, that is the conversation to have with your doctor this week. Ask about H2 blockers like famotidine, sold as Pepcid, which are far gentler on the brain. The goal is the lowest dose for the shortest possible time, not a pill you take forever out of habit. Number 3 is prescribed for a problem many seniors are embarrassed to discuss. Oxybutynin, sold as Ditropan, is given for overactive bladder, the sudden, urgent need to reach the bathroom that can reshape an entire day. The relief it provides is real. The embarrassment it spares people is real. But what almost no senior is ever told is this. Oxybutynin works by blocking the exact same brain chemical as Benadryl, acetylcholine. And this one crosses into the brain very easily, parking itself directly in the memory centers where new information is stored. A 2019 study in the British Medical Journal followed adults over 65 who took strong anticholinergic drugs like oxybutynin for more than 1 year. Their risk of developing dementia was 49% higher, close to 1 in 2, and almost none of them were ever warned. The good news is that you do not have to choose between your bladder and your brain. A newer medication called mirabegron, sold as Myrbetriq, works through a completely different pathway and does not block acetylcholine at all. Bring this up at your next appointment. Ask specifically about mirabegron. Your doctor may not mention it unless you do. Quick pause right here. If this information is connecting dots for you, if you are sitting there thinking about a medication on your shelf right now, please hit the like button. It takes 1 second, and it helps this video reach the seniors who need to hear it most. Now, number 2 is one that genuinely surprises most people. Let us keep going. Number 2 is among the most commonly prescribed drugs in America for anxiety and sleep problems. Lorazepam, sold as Ativan, diazepam, sold as Valium, alprazolam, sold as Xanax. These are handed to millions of seniors every year, often with very little warning about what long-term use can do to the aging brain. At first, they feel like a rescue. The anxiety fades, the racing thoughts slow down, sleep finally comes. But over months and years, the picture changes in ways that are very difficult to reverse. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications like diazepam were even more problematic because they accumulate in the body's fatty tissues, including brain tissue, over time. What makes this medication category particularly dangerous is the exit. If a benzodiazepine is stopped suddenly, anxiety and insomnia often return with far greater intensity, making the medication feel essential at precisely the moment it may be causing the most harm. If you have been taking one of these medications for more than a few weeks, do not stop suddenly. That can be dangerous. Work closely with your doctor to taper the dose gradually over weeks or even months. Buspirone is one alternative for anxiety that does not carry the same cognitive risk. Ask about it by name. And now, number 1. You may have been expecting one final worst pill, one single villain. The reality is more dangerous than that. Number 1 is not a single medication. It is what happens when a senior takes 2, 3, or even 4 of the medications we have discussed at the same time, while nobody calculates the total damage being done to the brain. Researchers call it anticholinergic burden. Imagine a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every morning for the bladder, and a PM pain reliever for joint pain in the evening. Each one alone might produce only a small and barely noticeable effect. Together, the damage compounds. The brain is being blocked from multiple directions at once, and the neurons begin to weaken from the cumulative pressure. A 2022 study in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk. And the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. Here is the hopeful part, and it is the reason I made this video. Medication-induced cognitive decline is often reversible when it is caught early enough. Reduce the burden, and many seniors regain their clarity, their energy, and their memory within weeks or months. The brain is far more resilient than most people realize, but only when the source of harm is removed. Schedule a medication review. Sit down with your doctor or pharmacist and go through every prescription, every over-the-counter product, and every supplement you take. Ask them to calculate your total anticholinergic burden. That single conversation may be the most important health decision you make this year. Now I want to hear from you. Which of these 5 medications are currently in your medicine cabinet? Have you noticed brain fog, memory slipping, or confusion after starting a new prescription? Tell me in the comments below. Your experience may be exactly what helps the next person who reads it. And before you go, there are warning signs your body is already sending that most seniors completely miss. They appear somewhere you look every single day, but never think to examine. That is the topic of the next video. I will see you there.